So stomach acid is very, very acidic. It exists like that to help break down food inside your stomach. Your stomach lining is well built to deal with the acid, so your stomach is okay, but when the acid goes up into your esophagus, you don't have any of those barriers there. And the lining of the esophagus can get worn down and get ulcerations, and that's what we call erosive esophagitis. So there are two things that keep all of the stomach contents inside the stomach. One is a circular muscle called the lower esophageal sphincter, and the other is actually your diaphragm. And both of those things combine and they help separate the esophagus and the stomach and keep the gastric contents in the stomach. So if you have a problem with your lower esophageal sphincter, either from medications or from various lifestyle things that can lead to excessive relaxation of this muscle, it allows gastric contents, the food and the acid in the stomach, to come back up into the esophagus, leading to the symptoms of heartburn, acid reflux, but also over time to damage to the esophagus. Heartburn and acid reflux is just a sensation of something coming up from your stomach into your chest. These things are just symptoms, and they can be completely mild or not really very serious if they happen infrequently or not very severe. But frequent acid reflux can lead to damage to your esophagus or erosive esophagitis. The symptoms of erosive esophagitis can vary quite widely. Kind of on the minor end, you have things like mild heartburn or the feeling of acid coming back up into your chest. But also they can be as severe as a lot of pain when you swallow or food even getting stuck. And more serious complications include life-threatening things like bleeding as well. So if you're having ongoing issues with heartburn where it's bothering you multiple times a week or the symptoms are very severe, you should definitely see a doctor or specifically a gastroenterologist for further evaluation and conversation about these things, potentially some confirmatory testing like an upper endoscopy, which is a completely painless like 10-15 minute test. And those things can really help you understand what you have going on inside your body, help start treatment plans, and potentially lead to the prevention of a lot of serious consequences, such as life-threatening bleeding, development of strictures or narrowing of the esophagus that would prevent you from eating.